Thanks for joining us for the Transforming Public Health for the 21st Century blog. This month, we're doing something a little bit different. The past 3 blogs have focused on trust in public health, why local health departments may be the linchpin, how trust can be measured, and how reflective action can turn that trust into meaningful change. My name is Caroline Spayth, Digital Communications Specialist at the Kansas Health Institute. Now let's take a closer look behind the blogs.
Hi, my name is Kovach. I'm a principal strategist for Public Health Services and Systems here with the Kansas Health Institute.
Tell me about the collection of blogs in Trust in Public Health.
So over the last couple months, we wrote 3 blog posts on trust in public health, and it originated, I was working with a public health practitioner in Kansas, and they were actually writing a blog post on authentic community engagement. And when I was helping her with the post, I came across this data that showed local health departments not only were the most trusted of public health institutions right now, but their trust levels had actually increased from before and after the pandemic compared to most of the other public health institutions, like state health departments, CDC, and other federal agencies, had actually decreased over the pandemic. And so it made me think, is this an opportunity that could be leveraged? Might they be the linchpin for rebuilding public health trust?
Yeah. So tell me about the 3 articles. Was there kind of a plan in place to go with all 3, or did it kind of just happen as you found more data and stuff like that?
It didn't start out with a plan. It started out with me seeing that article about the trust levels in public health and local health departments having the higher trust levels. I ended up doing a quick literature review around that, saw a few articles looking at that from different vantage points. They all tended to coalesce around the same story. So I go, you know what, maybe there is something here. Additionally, I found that there was an article that looked at why people trusted the different public health institutions. And this kind of gave a reason why local health departments might have higher trust. And the reason was people trusted the federal agencies and the state agencies for their scientific expertise and things like that. People trusted their local health departments for different reasons. They trusted them because they're part of the community, they knew who they were, they could work with them, or they had worked with them. There's these relational aspects of the local health departments, and that aligns really well with why people trust, in general. And trust is defined or can be thought of as people's openness to be vulnerable or to put themselves at risk because they have positive expectations about another actor. So these things are rooted in, does the other person or does the public health institution care about me or care about people like me? Does the public health institution, are they competent, and can they do what they say they are intending to do? Can they protect and promote health? Are they consistent in the way that they work? We saw this in the pandemic with new recommendations coming out all the time. And then, are they principled? Do they have principles that they work with? Do they abide by them consistently? And are these principles aligned with my principles? So those things are kind of some of the things that can impact trust. And we saw that with these relational factors pointing to a lot of these things, and maybe being the reason why the trust levels were the way they were.
Right. So that kind of goes along with your imagery for the linchpin and the leverage. Can you talk more about how you came to those terms, or how you came up with that image?
Well, I can't say that it was planned, but as the first blog post was coalescing, the theme really was pinpointing on the local health departments and their kind of unique vantage point in the system. So that leveraged itself to the linchpin metaphor, and they have a specific spot in the system that's different than other public health agencies, and could help be that, help really rebuild trust by that position. The other two blog posts, the second one was focused on how do we measure trust, and the third one was focused on reflective action, to rebuild trust. So actually taking action and not just getting stuck in a planning phase. And those two posts focused on the lever metaphor, and the idea there is that linchpins don't actually take action; they hold things together. We still need to, take action and be that lever for change.
Gotcha. In the first blog post, you refer to 3 strategic moves that kind of launch into your next couple blogs. Can you talk about how those came to be?
Sure. The first strategic move is that health departments can demonstrate competence by solving problems that people care about. Public health is solving problems all the time, but a lot of times it's behind the scenes. People need to know the great work that public health is doing, and they need to be able to connect it with their lives. And I think by communicating the value and connecting it to people's day-to-day lives, like that's important work for public health leaders. So that's one thing that public health leaders can do. The second is fostering integrity through ethical stewardship and public value. People need to know that the resources that they are providing to public health through their tax dollars are being spent wisely. And if you've ever worked in public health, you know that you are doing that. Public health people they spend money wisely and turn a nickel into a dollar all the time. But people need to know this, otherwise, they can imagine, many things if they don't know how the good work public health is doing. And then the strategic move 3 really leads into the next 2 blog posts. So this is measuring trust and building it through quality improvement, or as I call it later, reflective action. So then that really brings us into the next 2 blog posts.
Yeah. So what can public health leaders do to show communities they are trustworthy? So you talked about it a little bit. Are there any examples of this working that you know of, or are there ideas you have for that?
I think there's a lot of ideas that are out there that public health practitioners are doing. I think some of the most important leverage point might be really improving community engagement. Public health isn't something that an agency does or a health department does. It's something we as society and our communities are collectively doing. We're collectively making priorities, identifying our strengths and bringing them together, and solving problems that we care about. That's kind of the public health process in a nutshell. And the more that we get it out of our institutions and with our communities, the more trust I think will be built together.
Right. That community engagement is huge. That almost transparency through connecting, I think, is really important, and something that you talk a little bit about in the blog.
It's a good way to what better way to get to know each other than by actually working together.
Can you explain the Plan, Do, Study, Act approach?
So Plan, Do, Study, Act it's been around for a long time. It's used a lot in manufacturing and in medicine. The idea is that you develop a plan for solving a problem. You take action. You see how it affected your goals, and then you reflect on it and then take further action. But I think for rebuilding trust, one of the most important things here is to get out of the planning phase and start taking action. And the reason for that is if we're stuck in committees and in meetings, talking about how we're going to rebuild trust, but we never start rebuilding the trust or taking action to rebuild the trust, we're kind of just left guessing what's going to work.
Throughout these blogs, there's a lot of discussion on what kind of public health leaders, health departments, and institutions can do to build trust. So on kind of the flip side of that, what can the general public do? Like what can the communities do to build that trust?
Well, I think it's the flip side of community engagement, and it's engaging with your institutions as a community and as a public. Government institutions, they're kind of us, right? So engage with your health department, reach out to them, and let them know what you think is important, in a constructive way. And also, if you think something is a priority or is important, you probably have skills that the health department would be happy to help connect you with people to, put into place to solve those problems that you think are important.
At the end of the third blog post, you close with kind of pulling the lever, that kind of analogy. What is the next step for building trust? Is there a next step for you, a next step that you'd like to see?
Public health has a lot of data and a lot of systems in place to measure health indicators and things like that. And trust is actually a health indicator because it's associated with a number of behavioral risk factors. Another thing that I think KHI would be interested in doing is working with health departments and public health leaders to think about how to actually start taking action in rebuilding trust. And it feels very amorphous when you think about how do you rebuild trust, but if you break it down into the way that public health approaches, all the other big challenges that we take on, we can use some of the same frameworks like the Plan, Do, Study, Act, like reflective action, like action learning, to start taking action on this issue.